Hello everyone. Today we are going to study the topic prostatic enlargement and homeopathic treatment. So, prostatic enlargement, also known as benign prostatic hyperplasia (BPH), is a common condition in aging men. It involves the non-cancerous growth of the prostate gland which surrounds the urethra and can lead to the symptoms such as 1. Frequent urination. You may feel the need to urinate more often, especially at night. 2. Difficulty starting urination. It may be challenging to begin urination, or there may be a weak or interrupted urine stream. Third one, incomplete emptying. You might feel like you still need to urinate even after just going to the bathroom. Fourth one, urgency. There may be a sudden, intense urge to urinate which can be difficult to control. Fifth one, urinary retention. In severe cases, BPH can lead to urinary retention, where you are unable to empty your bladder completely. So now we see what are the investigation to find out the prostatic enlargement. The first one is a medical history and physical examination. Symptom assessment. Doctor will ask about urinary symptoms using tool like the International Prostate Symptom Score IPSS. 2. Digital rectal examination DRE. The physician inserts a globe lubricated finger into the rectum to feel the prostate for enlargement, lumps or hard areas. Second one, urine test, urine analysis. Check for the sign of infection, blood or other abnormalities in the urine. Second one is the urine flow study. Measures the strength and amount of the urine flow. The next test is a PSA test. Measures the level of the prostate specific antigen in the blood. Elevated levels may suggest prostate enlargement or other prostate related issues including prostate cancer. Fourth one is a imaging test. USG, ultrasound, transrectal ultrasound, TRUS, can help measure the size of the prostate and detect abnormalities. Next test is a urodynamic study. Assess the function of the bladder and urethra. The next test is a cystoscopy. A scope is inserted through the urethra to visualize the bladder and prostate, allowing direct assessment of the urinary tract. The next test is a biopsy. If there are concerns about the prostate cancer, a biopsy may be performed where small samples of prostate tissue are removed for microscopic examination. Now we'll see what is the homeopathic approach. Homeopathy is a system of medicine that uses highly diluted substances to stimulate the body's natural healing process. It is based on the principle of like cures like, where a substance that causes symptoms in a healthy person is used in a highly diluted form to treat the similar symptoms in a person who is unwell. In homeopathy, a practitioner would consider the specific symptoms and characteristics of the individual, taking into account not only the physical symptoms but also the person's mental and emotional state. Here are some homeopathic medicines that are sometimes suggested for symptoms associated with prostate enlargement. Now, what are the homeopathic medicines which are used for the prostate? The first important medicine is a Sabal cerulata. This remedy is often recommended for symptoms such as difficulty initiating urination, a weak urinary stream, and frequent urination, especially at night. Quite useful in mother tincture. Next one is a Conium M. It may be considered where there is a difficulty in starting urination. Flow intermits, then flow again. Conium is best suited to the diseases of old men, old bachelors with rigid muscular fibers with light hair, strong persons of the sedentary habits, cancerous and scrofulous persons with enlarged gland. Next important medicine is a Thuja occidentalis, antipsychotic remedy. This remedy may be indicated when there are urinary symptoms along with the sensation of obstruction or pressure in the perineum, severe cutting at the close of the urination. Another medicine is sarsaparilla. Next important medicine is a Chimaphila. It is suggested when there is a frequent urge to urinate and the urine stream is weak. Next important medicine is a Staphysagaria. This remedy may be considered when there are symptoms related to the suppressed emotions or feeling of humiliation, as it is often recommended for conditions associated with emotional stresses. Next rare medicine is a Ferrum picricum. Acts best in dark hair patients, plethoric with sensitive livers, warts and epithelial growths, corn with yellowish discoloration, senile hypertrophy of the prostate. Next important medicine is a populous tea, American aspen. The gastric and urinary symptoms points to its usefulness in dyspepsia and catarrh of the bladder, especially in old people. Prostate enlargement. Next important medicine can be used homeopathically and biochemical. So, is a Calcarea fluor. Hard nodules in the prostate. Calcarea fluor is often recommended when there are hard nodules in the prostate gland. Pain and discomfort is there. If there is a pain or discomfort in the region of the prostate, especially if it is aggravated by pressure or touch, Calcarea fluor may be considered. Slow development. This remedy may be indicated when the enlargement of the prostate gland occurs gradually over a time. Now we will see the Kent repertory or Kent's repertory representation of the prostate. Now you will find in the gland enlargement or the prostate gland enlargement, the medicine given by Kent are Baraita calf, Calcarea calf, Conium, Digitalis and Pulsatilla. Then you will find hardness of prostate, medicine is Conium. Induration of prostate, the medicine given is Thuja. Inflammation of the prostate, medicine given is Apis, Chimaphila and Pulsatilla. Swelling of the prostate, medicine given is a Chimaphila. Now we will see the concluding part. It is crucial to consult with a qualified homeopathic practitioner before trying any homeopathic remedies. They can help to determine the most appropriate remedy based on your individual symptoms and overall health. Thank you.